Hello, as we said last time, erectile dysfunction is a medical diagnosis. Just because you've had a breakdown with your wife once or twice doesn't mean you should assume you have erectile dysfunction. Yes, it's after seeing a specialist, usually a urologist, and after undergoing a series of medical and laboratory tests that the doctor will declare you suffering from erectile dysfunction. Knowing this is very important so that you do not consider yourself suffering from a disease that you do not have, because then it will only worsen your situation and your mental state, which is an important part of erectile dysfunction. That being said, let's begin the second episode of our program. Today, we will describe in detail what this dysfunction is.
Although its definition may be clear and simple, let's see in more detail what it is exactly.
Erectile dysfunction is the inability to achieve and/or maintain an erection sufficient to satisfy one's spouse, or better yet, one's wife. We want to make this clear because, for us, intimate relations are between a man and a woman within the framework of marriage. This is also why we strongly advise our patients to bring their wives to the consultation. I should note that some men do not prefer this, but this is our recommendation. Now, back to the definition. If you manage to get an erection, but it is soft, it is not firm and hard like a stick or a rod, to the point of performing penetration and possibly making several back and forth movements. This is already a warning sign. Before going any further, I would like to clarify one thing. It should be noted that the shape the penis takes when erect, which is called the phallus or penis, does not constitute an erectile dysfunction. There is a semantic difference between the penis and the phallus or penis. The penis is the male genitalia when flaccid, while the phallus or penis is the male genitalia during erection. So, the penis can take several different shapes without it being considered erectile dysfunction since the penis is already erect. We can talk about the impact and cause of these penis shapes in another show.
But doctor, what are the main erectile dysfunctions?
There are at least 3 types of erectile dysfunction, 2 of which are the most common. These are premature ejaculation and sexual impotence. The third disorder, less common, is priapism, which is an erection that is exaggerated in duration, but often also in hardness or firmness. This can have destructive consequences on the penis as an organ. Premature ejaculation is, as its name suggests, a disorder in which the erection can be firm and hard, but does not remain so for long. Often, from the very first movements of penetration, ejaculation occurs practically to the disappointment of the man himself, and of course, without his will. This disorder is by far the most common, but fortunately the easiest to cure. Sexual impotence is a disorder in which an erection may or may not exist. When it does exist, it is partial and soft, and therefore not hard enough to allow for proper back and forth movements, and thus satisfy the partner. It is most often secondary to an underlying problem. Regarding penis size, it should be noted that the size of a man's penis has nothing to do with erectile dysfunction. The size can be small or large. As long as the penis can achieve a hard and firm erection, there is no talk of erectile dysfunction. The other case of sexual impotence is when the penis does not enter into an erection at all. We then speak of total sexual impotence. It can be primary or secondary. We will discuss this later. However, we must distinguish 2 things. There is physiological impotence, also called refractory period, which is normal and which occurs immediately after ejaculation. It takes on average 20 minutes, even less in younger men, and up to an hour or 2 in some older men without it being abnormal before a new hard and firm erection appears again.
The question, doctor, is where do I fit into this whole description?
Well, it's up to you. Who follow me to situate yourself. What are the signs you observe with the lady at home? The most important thing to know is that most erectile dysfunctions, about 90% of them, are secondary to underlying pathologies or situations that are absolutely treatable or controllable, if not totally. But proper care can bring about a significant improvement to the point of bringing the couple's intimate life back to normal. These causes are therefore essentially organohormonal, psychological, and due to the taking of certain medications, which is what will constitute the content of the following episode. Don't forget to subscribe to our YouTube channel, like and share all our videos, and of course follow us on all our social media accounts.